CEN Test Prep Exam Sample Questions. Question 1. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option A, hyperkalemia. Option B, hypercalcemia. Option C, hypocalcemia. Option D, hypermagnesemia. The correct answer is option C, hypocalcemia. Question 2. The nurse is caring for a patient with suspected serotonin syndrome. Which finding is most consistent with this diagnosis? Option A, pinpoint pupils and respiratory depression. Option B, a dry skin and absent bowel sounds. Option C, hyperreflexia, clonus, and agitation. Option D, bradycardia and hypotension. The correct answer is option C, hyperreflexia, clonus, and agitation. Question 3. A positive Koenig's sign is suggestive of: Option A, a cerebral aneurysm. Option B, subdural hematoma. Option C, meningeal irritation. Option D, cerebellar stroke. The correct answer is option C, meningeal irritation. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects: Option A, open-angle glaucoma. Option B, acute angle-closure glaucoma. Option C, a conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Question 5. The hallmark sign of compartment syndrome is: Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Question 6. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 7. A patient with known cirrhosis presents with massive hematmesis. The nurse suspects bleeding from: Option A, peptic ulcer. Option B, esophageal varices. Option C, a hemorrhoids. Option D, Mallory-Weiss-Tear. The correct answer is option B, esophageal varices. Question 8. Sengstaken-Blakemore tube placement is used as a temporizing measure for bleeding from: Option A, peptic ulcer. Option B, esophageal varices. Option C, diverticulosis. Option D, aortoenteric fistula. The correct answer is option B, esophageal varices. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be: Option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive. Question 10. Which assessment finding is consistent with a flail chest? Option A, a crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Question 11. Testicular torsion is a surgical emergency that requires intervention within: Option A, 24 hours. Option B, 4-6 hours. Option C, 2-3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 12. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide minus complex tachycardia at 220 bpm. What is the priority intervention? Option A: administer amiodarone 300 mg for push. Option B: a synchronized cardioversion at 100 J. Option C: immediate high minus quality CPR and defibrillation. Option D: a transcutaneous pacing. The correct answer is option C: immediate high minus quality CPR and defibrillation. Question 13. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A: insert a urinary catheter immediately. Option B: perform a retrograde urethrogram before catheter insertion. Option C: irrigate the bladder with normal saline. Option D: prepare for suprapubic catheter. The correct answer is option B: perform a retrograde urethrogram before catheter insertion. Question 14. Hepatitis A is primarily transmitted via: Option A: blood and body fluids. Option B: fecal minus oral route. Option C: sexual contact. Option D: contaminated needles. The correct answer is option B: fecal minus oral route. Question 15. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is: Option A: green, minor. Option B: yellow, delayed. Option C: red, immediate. Option D: black, deceased/expectant. The correct answer is option C: red, immediate. Question 16. Pulsus paradocus is a classic finding in which condition? Option A: cardiac tamponade. Option B: pulmonary embolism. Option C: aortic aneurysm. Option D: congestive heart failure. The correct answer is option A: cardiac tamponade. Question 17. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: Option A: application of ice to the bite. Option B: incising and suctioning the wound. Option C: application of a tourniquet proximal to the bite. Option D: administration of antivenom, crotality. The correct answer is option D: administration of antivenom, crotality. Question 18. Meningitis is an inflammation of the: Option A: brain parenchyma. Option B: meninges covering the brain and spinal cord. Option C: peripheral nerves. Option D: ventricles of the brain. The correct answer is option B: meninges covering the brain and spinal cord. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as: Option A: Gray-Turner's sign. Option B: Cullen's sign. Option C: Murphy's sign. Option D: Rovsing's sign. The correct answer is option B: Cullen's sign. Question 20. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as: Option A: TSI level 1. Option B: TSI level 2. Option C: TSI level 3. Option D: TSI level 4. The correct answer is option A: ESI level 1. Question 21. The purpose of administering surfactant to a patient with ARDS is to: Option A: bronchodilate the airways. Option B: reduce alveolar surface tension and prevent atelectasis. Option C: decrease pulmonary capillary permeability. Option D: increase mucociliary clearance. The correct answer is option B: reduce alveolar surface tension and prevent atelectasis. Question 22. A patient presents with cholinergic symptoms: salivation, lacrimation, urination, defecation, GI upset, emesis, meiosis. This toxidrome is most likely caused by: Option A: anticholinergics. Option B: sympathomimetics. Option C: cholinergics, organophosphates. Option D. Opioids. The correct answer is option C. Cholinergics, organophosphates. Question 23. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A. Patch both eyes. Option B. Immediate copious irrigation with water or normal saline. Option C. Administer topical antibiotic drops. Option D. Perform a visual acuity test. The correct answer is option B. Immediate copious irrigation with water or normal saline. Question 24. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A. Pain medication. Option B. Intravenous fluids only. Option C. Immediate endotracheal intubation. Option D. A neurological reassessment in 15 minutes. The correct answer is option C. Immediate endotracheal intubation. Question 25. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A. Forcing oral fluids. Option B. Straining all urine. Option C. Pain management. Option D. Surgical consultation. The correct answer is option C. Pain management.